The healthcare model that can save Britain's NHS, and perhaps a lesson for America too. I grew up in the United Kingdom and have lots of family and friends who rely on the National Health Service. I've written previously how I believe that despite the idea of a completely free at the point of use healthcare system sounding very noble, and there are certainly many great things about the NHS, it's not a model that has been copied in any other country. As someone who also has lots of friends and former colleagues working in the NHS, I regularly hear stories about how that system is completely at breaking point. The British media also regularly communicate this message, and the NHS undoubtedly relies on a huge amount of goodwill. The ideal healthcare system probably resides somewhere in between this type of completely centralized, socialized system and a private insurance-based one. Out of all the systems I've experienced, Australia comes pretty close to this midpoint, a system I've worked in myself during my final year of medical school. Following the Australian model, here is what the United Kingdom should do, summed up in two straightforward steps. Number one, keep the NHS in place as is. Number two, encourage everyone who can afford it to take out their own private health insurance and then give them a tax rebate for doing so. This would be an ideal solution because great swathes of the middle classes and wealthy will likely leave the public NHS, thus relieving pressure on the system. If for any reason they aren't happy with their insurance-based system or coverage, they can always go back to the NHS. Sounds simple, right? Back to reality. Here is what's blocking such a good idea from happening in Britain. Number one, British psyche. I'm afraid it is so ingrained in the national psyche that healthcare must be free that any such proposal to encourage people out of the NHS would likely cause a national uproar among large swathes of the population, however sensible it sounds. Number two, political tool. Whichever political party proposes what I've just discussed would likely be annihilated with screams from the opposition parties that they want to privatize the NHS when actually no such thing is happening. We are just being pragmatic and realistic, and if someone leaves the NHS, it's only fair that they should get some tax back, like in Australia. There would also be talk of a two-tier system. So what? That's life, as long as the public system is still excellent. Doctors could have it written in their contracts that they must do a certain amount of work in the NHS so they don't leave it completely. Because of these issues, the Australian model, which would probably work so well in a prosperous nation like the UK, seems like a pipe dream. As for America, if we are approaching this type of healthcare system from almost the opposite end of the spectrum, why not have this scenario? Number one, a single-payer system for anyone who desires it, Medicare available to all, or at least lower the current age of eligibility. Number two, a private insurance-based system with tax breaks for anyone who can afford it and offered by employers as a job benefit. In healthcare, things that sound so straightforward and obvious seem all too hard to come by.